If you're experiencing SI joint pain in pregnancy, so a sharp pain or a deep ache in the back of your pelvis that gets worse with walking, standing on one leg to get dressed, rolling over in bed, then you're in the right place. Most moms are just told to rest more or stretch it out. But if you've already tried that, you know that the relief does not last. The truth about SI joint pain in pregnancy is that it is less about tight muscles and more about pelvic instability caused by normal pregnancy changes like hormones, posture, and load distribution. Hi, I'm Dr. Anna Towne, pelvic floor physical therapist, pre- and postnatal specialist, and mom of almost 4. In this video, I will go over the real causes of SI joint pain in pregnancy and guide you through pregnancy-safe exercises that will help you stabilize your pelvis, reduce pain, and make everyday movements feel more supported. Let's jump right in. Your SI joints help connect your spine to your pelvis and help transfer load when you walk, when you move, when you change positions. During pregnancy, hormones like relaxin increase joint laxity in order to prepare for birth. While this is normal, it can sometimes create too much movement in the pelvis without enough muscular support. In some cases, muscle imbalances can develop between the right and the left side, or the pelvis might shift into a slight rotation. This can place extra stress on the SI joint and lead to irritation, often showing up as one-sided low back or pelvis pain, pain with walking upstairs or walking, discomfort getting out of bed or standing on one leg, and a feeling of instability or catching in the pelvis. Before we work to create more stability, we first want to reduce tension and create space at the SI joint. Then we can work to create balance in the muscles that support the pelvis. From there, strengthening the glutes, one of the biggest stabilizers of the SI joint, along with the deep core and pelvic support muscles, can help improve stability and decrease discomfort. As you go through these exercises, please listen to your body. Stop or modify if you notice sharp or increasing pain in the pelvis or low back, feeling of instability or giving away, pain that worsens during or after movement, any movement that doesn't feel supported or controlled. All right, mama, let's start our 5 pregnancy-safe exercises that support your SI joint and reduce your pelvic pain. Go ahead and start with your knees out wide, and you're gonna put your elbows really nice and close to your knees, and you're gonna come down into a modified child's pose position. So make your knees as wide as you need to so you can drop your bottom down to your heels, even with that baby bump, okay? So we're gonna go ahead and open up that sacroiliac joint as much as we can in this position. You're going to inhale through your nose, breathing into your upper, middle, and low back, and then exhale through your mouth. So each breath, I want you to try and open up your back a little bit more and get that air down into your middle and low spine, even into that sacrum area. Exhale through your mouth. So make sure you're in a comfortable position here. If you need to modify or move in any way you can, again, make those knees wider, but we want to be in a compact position so it's challenging to breathe in this area, and it forces the air to go into that mid-back and down into that low spine. Couple more breaths here. Inhale through that nose, and then exhale through that mouth. You should feel lengthening throughout the spine and opening in that low back area. One more breath. Inhale through your nose. And then exhale all the way out. And then slowly come on up out of it. Grab a ball and go ahead and lay on your back here with your feet up on a chair and your knees and your hips at a 90-degree angle. We're gonna go ahead and start in a posterior pelvic tilt. So pushing your low back down, lift the tip of your tush up off of the ground. And in this position, we're gonna do some deep diaphragmatic breathing. So you're gonna inhale through your nose, breathing into your side ribs, and then exhale through your mouth. As you exhale, drop that rib cage down towards the mat. In this position, keep breathing. I want you to dig your heels into the chair to engage the hamstrings or the back of the thighs. I also want you to gently be squeezing that ball to feel your inner thighs engage. So we're holding in that position as we are breathing. So inhale through your nose and exhale through your mouth. You want to make sure you're getting equal work coming from both legs. So make sure you feel both left heel and right heel digging into the chair. Also, both knees gently squeezing that ball. Couple more breaths here. Inhale through the nose. Exhale through your mouth. This is a great alignment exercise. We're using hamstrings, adductors, everything around that pelvis to help stabilize that sacroiliac joint. Inhale through your nose, last one. And exhale all the way out. Drop those ribs down towards the floor as you let all that air out. And then slowly relax out of that tilt. Go ahead and go on your hands and your knees. So hands are right underneath your shoulders, knees right underneath your hips. So you're gonna extend your right leg out here away from your body. As you lengthen that leg, I also want you to engage that glute or squeeze those butt muscles. We're gonna lift that leg up off of the ground as we rotate it over across and tap it down to the floor, then lift it up, reach over. So if you are on a yoga mat here, we're going lift over to one edge of the mat and then lift back up to the other side of the mat. So we're engaging a lot of our gluteus maximus, which is one of our most important muscles for pelvis stabilization. It is a really good stabilizer of that sacroiliac joint, that SI joint that we are trying to get more stable and more strength through. So lift up and over, lift up and over. So you're feeling both the stabilizing hip that you are resting down on your knee, and then the lifting leg where you lift up and over and tap, and then same thing. If you need to modify this at any point, you can always come onto those fists to protect those wrists, or grab hand weights so you're protecting those wrists. Almost done here. Last one. Rotating over, back up. Nice job. Go ahead and lay on your right side with your right elbow right underneath your right shoulder. And then we want our bottom knee to be bent and our top leg is out straight. You're going to inhale through your nose. As you exhale, lift your right hip off of the ground and lift your left leg up. Hold there and then slowly come back down. So as you lift that top leg, I want that foot to stay parallel to the floor. We want to make sure that we are lifting with our whole foot and not just with our toe. If we're lifting with our toe, then that's going to be using more of that hip flexor, whereas we want to be feeling the side hips or the gluteus medius muscle. So as you lower down and then lift back up, we're going to be feeling both top and bottom side hip. This one is a quick, easy burn on both, again, bottom and top side hips here. So feeling it really right where that side back pocket would be. Couple more. If you need to slow down the pace, you can at any point. Do what feels comfortable and safe for you. Last one here. Nice job. Go ahead and grab one heavy weight, and you're gonna start by standing on your left leg, and you're gonna kickstand up on the right toes. So they're just there for balance and stability. We're gonna go ahead and go to a Romanian deadlift, kickstand again. So most of our weight is on our left. We're gonna reach that weight down towards our left knee, down towards our left shin as far as we feel comfortable, and then slowly stand on up. So we are reaching cross body here. So our right hand is reaching again down towards our knee, down towards our shin, as low as you feel comfortable, and then coming on up. So we're inhaling down, exhaling as you come up. Again, not very much weight coming from that back leg here. We want the majority of the work coming through that left leg. So soft knee bend here on that left knee. So it's not a squat, it's a Romanian deadlift here. Those are different movements. We're really focusing on our hinge of that left hip. So hinge that hip back. We're getting length through that glute, which is so important for us. In pregnancy, we tend to have glutes that clench and that really tighten up, but we wanna find length in the back of that hip, and that's going to help your SI joint dramatically. All right, let's do a couple more here. Focus on that breath. Inhale down, exhale up. Inhale down, exhale up. Nice work. And that's your SI joint pain relief routine for pregnancy. Structured, safe, and designed to improve pelvic stability and reduce discomfort with movement. If this video helped you better understand your SI joint pain during pregnancy, make sure you subscribe for more pelvic floor PT approved exercise guidance. For more structured support throughout pregnancy, you can start your free trial of Strong Expecting Mama by clicking the link below. See you in the next video.